You know, midwives are an absolute lifeline for global health. But so often, their hands are tied by the very systems they work in. Today, we're going to explore why that's happening and, maybe more importantly, how we can empower them to save more lives. Think about it. Midwives are right there on the front lines, yet all these systemic barriers are holding them back. And this isn't just about one profession. No, this is about a global health crisis that, one way or another, really affects all of us. So let's get into it. What's really at stake here? We'll start by looking at just how fundamental midwives are. I mean, they are, quite literally, a lifeline for entire communities. Now, this definition is so important. International organizations see midwives as a really cost-effective path to universal health coverage. And their role, well, it goes way beyond just delivering babies. They provide this whole spectrum of care that is the very bedrock of a healthy society. Okay, so what does success actually look like? What happens when a healthcare system fully unleashes the potential of its midwives? Let's take a look at the blueprint for excellence. Right. Success doesn't just happen by accident. It's a structure, and it's built on three essential pillars. You need unwavering political will, strong organizational support, and that professional autonomy that allows midwives to really do their jobs to the best of their ability. And what's really fascinating here is the direct link to outcomes. I mean, look at places like Sweden, where midwifery is valued both legally and socially. The results are just so powerful. Fewer mothers and babies die. It's proof that political and societal backing literally saves lives. It's as simple as that. But good laws are only the beginning. This here shows you the next critical layers. We're talking about well-funded education, clear regulations, and, really importantly, deep community trust. When a midwife is supported and empowered to make decisions, the quality of care just skyrockets. So that's the ideal scenario. But what does the reality look like on the ground? Let's turn our attention to Ghana, where the challenges and the opportunities for midwives come into really sharp focus. 1 to 560. Let that sink in. That's the estimated patient-to-midwife ratio in Ghana. It's a number that is just way beyond the World Health Organization's recommended limits. And this isn't just a statistic, it's a story of immense pressure on a critical workforce. And that pressure, it's not felt equally across the board. As you can see right here, there's a huge divide between urban and rural areas. This isn't just about numbers. This is a dangerous gap in healthcare access for the people who need it most. And for those midwives working in rural communities, the challenges just pile on. They're dealing with limited resources, fewer chances for professional growth, and they have little to no say in policymaking. It's a recipe for burnout and, honestly, for systemic failure. So we have the ideal on one hand, and then we have the reality in Ghana on the other. The big question is, how in the world do we bridge that divide? When you put it side by side like this, the gaps become crystal clear. High-performing systems, they offer full legal recognition and autonomy. In Ghana, it's only partial. Successful systems provide resources fairly. In Ghana, they're focused on the cities. This table doesn't just show a difference, it shows a roadmap for what needs to change. But listen, this isn't an unsolvable problem. The research points to a really clear path forward, and it all comes down to one powerful concept: empowerment. And here's the blueprint: 4 concrete, actionable steps that can totally transform the system. We're talking about reforming policy, investing in education and leadership, rebalancing how resources are allocated, and deepening community engagement. So let's break this down a bit. It means legally recognizing midwives' autonomy. It means training them not just as clinicians, but as leaders. It means actually funding the rural communities that need it most. And crucially, it means partnering with communities, not just working in them. This quote from the source material, it really says it all. The potential is there. Midwives are ready to drive change. They just need to be empowered to do it. And while we've focused a lot on Ghana, this is not just a Ghanaian story. These challenges of underfunding, lack of recognition, and workforce disparity, they're global. So the lessons we learn here can be applied everywhere. So, at the end of the day, we have the blueprint for success. We know that empowering midwives through policy, education, and resources saves lives. So the real question isn't how to do it, it's if we have the collective will to act. How much of this incredible, life-saving potential are we willing to waste? Thanks for tuning in to this explainer.